Hello, today we have Dr. Lee Thompson with us from Cancer Surgery of Mobile to discuss melanoma. Dr. Thompson, what is melanoma?
Melanoma is a skin cancer primarily because it occurs in the part of the skin that produces color, and that's where it gets its name. But it's one of the most dangerous skin cancers we treat, and that's what makes it so devastating. Is if we don't catch it early, there's very little treatment for the later stages. So being aware and having skin awareness so that people notice these lesions early and coming to the doctor before they become a problem is really important.
What is the difference between melanoma and regular skin cancer?
Well, melanoma is more dangerous because it can metastasize or spread quicker and earlier. The other skin cancers tend to not do that. So they, even though they become a local problem and they're common, they're a lot easier to treat even in later times or if you ignore them for a while.
So Dr. Thompson, if someone's concerned that they may have melanoma or skin cancer, what is the process?
Well, first of all, just go to their regular doc that knows them well, and a dermatologist or someone who can do a biopsy of the lesion is going to be real important. Sometimes they can recognize or look at the lesion and they can tell you that it's probably not going to be an important thing or something that needs to be biopsied. But if they are concerned, the first step is to get a good biopsy so we know what it is.
What should they be concerned about? If they have a mole or...
Yeah, that's a very good question. If you have something, a lot of people have dark lesions and moles and things on their skin, and there are lots of good websites and places you can go to actually look at pictures too, which helps. But anything that's dark or irregular, if it's itching or bleeding especially concerning, if it's something that's changed over time, it's probably something that needs to be evaluated. And they do give some different characteristics for melanoma, but anything that you're concerned about, I would bring up to your physician and talk to them about.
Okay, and so we've talked about what you do if you're concerned that you have it. How can you prevent? Sunscreen?
Yeah, that's real important because if we could prevent ever developing melanoma, obviously you'd cure, that's the key. But staying out of the sun during critical times, especially in the middle of the day, especially in direct sunlight, more importantly, trying not to get burned. You know, a little sunlight's probably not going to damage you. Matter of fact, it may even have some positive effects. But if you are going to be out in the sun, just being sure you stay covered, stay in the shade as much as possible, and wearing sunscreen and reapplying sunscreen often if you are out in the sun. All those are very important.
So if you do develop melanoma, how do you treat it?
First step is just surgery. If it's an early melanoma, just removing the lesion can be very important. And that's the first treatment. And that may be the only treatment necessary. If it is a deeper melanoma or later stages, then we may do other things, including maybe take out some lymph nodes to check, maybe some more x-rays. Once it gets beyond that point, the options we have are very limited and would include some chemotherapy, but unlikely that we're going to be able to fix it permanently.
How effective are routine skin cancer screenings?
I think they're helpful as primarily making sure that patients are aware to look for things on their skin. Even if we don't find a lesion at a skin screening, at least the patient goes, or the public goes away knowing that they need to be aware of what's there and how to look for it. But occasionally we will find patients who have ignored something or for some reason have not gone to their doctor, and so I think that helps as well.
So in conclusion, we want to thank you for watching this video and thank you, Dr. Thompson, for coming. Do you have any tips you would like to leave the public with?
Yeah, we just be sure you're aware, know that it can happen, and if you do have things, go early, don't wait. And I think those are the most important factors.
Great.